an experience with blood cancer, leukemia, lymphoma, etc., to come and speak with us. The purpose of this is twofold. One is that we want to be in support of those that have been through this, are going through this, in some cases right in the middle of it. We have people that come out every week, which is our honored speakers. We have one honored teammate for the overall year, which you'll be meeting in a couple of weeks. Very special guy. What we get out of this is the inspiration for us to get through the practices, especially as the rides start getting longer. I can't tell you how many times I hit a hill and I'm thinking, oh, this is tough, or this is just the wind's in my face. And then I think back to Steve, I think back to my wife, I think back to people that have gone through this, and I think, this is nothing. You know, if they can get through what they've been through, I can do this too. And then it's twofold that we want to be able to express our gratitude to and our support to those that come speak with us. So one of the things that we do is we're passing around ribbons, different color every week for the different speaker that's come to talk with us. We get their pictures, we put it on a board that we'll have at every practice. We want you to be able to look at those folks, remember them. If you don't have your own connection directly to leukemia and lymphoma, one of the other blood cancers, listening to someone like Steve is a perfect way to find out who do you relate to, and maybe you adopt them as your own inspiration for why you ride. This is a big purpose. I'm in other cycling clubs. It's great to ride with other people, but we have a common goal here. We have a common purpose and a common passion, and that's that we are raising the funds that ultimately lead to the new breakthroughs that are in not only blood cancers but solid cancers, and provide the services that patients going through blood cancers need. So a little lengthier introduction than normal, but especially for those of you who are new, I want you to just understand what it is we're doing. This morning we have an amazing gentleman, Steve Rivero. He's talked to us before. This guy, I tell you, I humbly stand next to him, not only for what he's been through in his own life with his experience, but also for what he's turned that into, being a part of Team in Training. He's ridden with us before, he's spoken to us before, and this year riding Pacific Crest.
Crest, yeah.
Are you going for the Triple Crown?
Yes.
Going for a Triple Crown, which means in the events that he'll be doing up in Oregon, about a week or two, I think, after we ride Tahoe, if you complete events, 3 different events in Team in Training, you get what's called a Triple Crown. It's a big deal. It's a big deal. If you finish this, it's a big deal. If you can finish a marathon, triathlon, any of the other events, those are big deals. So Steve is one of those that's going for that Triple Crown. It's a big honor. Without further ado, I introduce you to the man, Steve Rivero.
Thank you. Well, he's told my story, so no. Anyway, thanks a lot, Brett.
Thank you, Steve.
Yeah, so I'd like to talk about my personal experience with lymphoma, a little bit more about my involvement with Team in Training, and then also talk about things that are coming up, and I may embarrass Brett at the end as well. So for me, it was about 9 years ago that I noticed a painless lump. I wasn't showing any kinds of other symptoms, and I had my physical set up next week, so went in, and the doctor said, well, don't really know what it is, we'll just kind of wait and watch. And over the next few months, to continue to grow, and started to get incredibly painful. And we went off on vacation knowing that something was wrong, but I'd had a biopsy just before we left on vacation. And when we were checking messages on the way home, there was a message from Kaiser Oncology wanting to set up a consult with me, so I knew that something was going on, but didn't know what. And came back and immediately went to the urgent care because I just wanted something for the pain, because it really had gotten really terrible. it's really hard to function. And so then, the physician, she's looking at my chart, and she just stopped and paused. And so, and my wife was with me too, and so I said, look, we know that I've got a consult set up, but I don't know what the diagnosis is yet. And so it says, oh, you have a lymphoma. And I said, what's that? I had no idea what it was. And so then that started the journey of figuring out exactly what kind. And so I had follicular non-Hodgkin's lymphoma. And it turns out that the type I had was indolent, so very slow growing. And as it turns out, that it was very treatable, but to this date it's still not curable. So I know I'm looking at relapse at some point. I just don't have any idea when that's going to happen. The fact that it hasn't happened yet is a pretty good deal. Usually if it comes back a lot more quickly, then it's usually a hell of a lot more aggressive. But when as I was going through treatment, I knew that about team and training. I had been a runner. I'd been involved with the H Marathon training program before, so that wasn't anything new to me. I was aware of the purple people from some of the events that we used to go to, and so I thought, great, I'll sign up, and then I'm gonna raise money for Leukemia and Lymphoma Society. And I finished my treatment just before the holidays that year in 2011, and then January I went in to get another PET scan and found out that there was a tumor behind my lungs that had persisted. So I had used one form of chemo, which was less aggressive. So really, outside of just a small group of my family and a small group of friends, nobody really knew what was going on, except I was working remotely a little bit, and I was able to carry on. But once I was going to start the next step, I knew it was going to be a lot more aggressive chemo. But I'd already signed up for team and training, and so I'm trying to find out information about people who have trained, while they've been going through treatment, because I knew I was going to be in for another 5 months, and couldn't find any information. And I talked to my oncologist, and she was very supportive. She said, if you can be active, that's really helpful, because a lot of people aren't able to, they feel like crap when they're going through the chemo. And luckily for me, I tolerated it pretty well. And I showed up to first practice, which was 3 weeks after my first chemo treatment with R-CHOP. And my hair was just starting to come out about that point. And so I started training with the group, and one of the things I learned was that during treatment week I couldn't run, but I could still walk. So I did that, and that team really helped me get through that season to get to my event, which I finished therapy in May of 2012, and then the half marathon I did in Alaska was in June, and I won. Well, I wasn't the first one, but I did it, and so to me that was the victory. And while we're waiting in the starting corral, that's when I signed up for my next event, which was Disney. And I, as a participant, I was really excited about all the support I had gotten through the organization, so I knew I was going to be involved a little bit more with team and training. I became a mentor, and really got involved in fundraising. Since then, so 2012, I've done 16 half marathons, one full, one try, and I did Amber last year with this team, which was pretty amazing. This guy really helped me last year when I was, a couple of my really difficult rides. The one where we went up the hills and through the valley, and when I was 3 miles away from the finish, and I started cramping up really badly, and this guy really helped me out a lot. He also helped me out in Tahoe too. So, this guy, he's awesome. I guess the thing I left off is now I've also been coaching for team and training for about 5 seasons, and so I'm still more of a runner, but on the event that Brett was describing, there's a 55-mile tour on the Friday, do a half marathon on the Saturday, and then an ultra tri on the Sunday. So Amber was my triple crown of 3 different events, but this time I'm going to get another one. Let's see, I guess that's this here. We're doing 3 all in one weekend, so I'm really I'm looking forward to that.
So when you're on your ride today and you're thinking how difficult this is,
but LLS has been doing a lot of great things, and the thing about me when I was going through my process, I'd used up 2 different regimens of chemo, and that's really not an option available to me for when I have relapse. So because cancer is really smart. It figures out after a little while how to react to the chemo and survive. It's really, really tricky. So what I was going to be looking at next after that would be bone marrow transplant, which is not a great thing to have to go through. There are a lot of survival rate isn't terrific. There's a lot of complications associated with it. But since that time, with all the developments that have come out, largely underwritten by LLS and largely supported by the funds that we've been raising, I'm probably looking at a couple of different targeted therapies down the road that would be options for me that would push the bone marrow transplant option really further down the road. Last year when I was actually about this time, we were here just a year ago. It was bright and sunny. You wouldn't be able to tell it now. But I was still coaching the West Side Marathon team, and one of the guys on that team, he was great. He was the coach's delight. He followed the training plan. He was there on time. Don't keep your coaches waiting.
What's his name?
Yeah. But what was interesting is that towards the end of that season, he was having a couple of issues with his hip and so forth, which as coaches we always help out our participants, try to figure out what things are going on with them, and usually there are things that'll work themselves out, with attention and treatment and all of that. And Mark, he had been involved with team training because his wife had blood cancer, and so she had gone through quite an arduous journey herself, and so he had been involved with team training for years. And so right after his event, he came back and he shared with me that the issue he had been having, it turned out that he had leukemia. And so I was just had my physical yesterday. When I was at the doctor's office, I haven't thought about Mark in a while, and I ought to send him a note to see how he's doing. And so I replied back. So I thought I'd share this with everybody. And so thanks for checking in, blah, blah, blah. Said my chemo went smoothly, and I've been declared ready for the stem cell transplant process. I had numerous tests over the last 2 years, And if there are no complications, the transplant will likely happen around mid-March. Once I emerge from my 2-week post-transplant confinement, there will be still restrictions on my activities, but I hope at that point I can resume dealing with the orthopedic issues so that maybe I'll get some idea when I can get off these blank crutches. It's possible that my hip socket can heal without surgery, but it may mean more time on crutches while waiting for the bone to regrow. I was told during my pre-transplant bone marrow biopsy yesterday that I have a strong hip bone, but I'm not assuming that it means anything in terms of how the socket will heal. Overall, I've been doing okay, mentally and physical, and still not in pain. Be well. And it just brought home, so as I was thinking about things I was going to be saying today, I was feeling pretty up, like a lot of things that are positive are happening, with me personally, and then to have something like this just happen, it's like you just don't know what may happen. So, keep an eye on yourselves, and be aware of yourself, because life is precious, and what the things that you are doing to help people like me, people like Mark, and others that we know are so important. So all the money raised is really going to a terrific cause. All the services that LLS provides, in addition to the funding for research and patient services and so forth, they're all incredibly important. One of the things I'm looking forward to next month is the blood cancer conference, which I get to go to every year, that LLS sponsors. And what's exciting there is to hear all the developments that happen every year. And it's incredible at the end, they just show you the list of all the advancements that have happened, and it's really incredible. It's really inspiring, and gives me a lot of hope, and I think it should give you all a lot of hope as well. So thanks for everything you do.
Thank you, Steve. So again, the numbers I'm going to quote to you now, I wish Meredith was here, she could correct me, I'm pretty close. What Steve's referring to is that there's a tremendous amount of research that's funded by the Leukemia and Lymphoma Society, and there are a lot of us that have had people ourselves or people that we love that have been saved through these treatments. Within of all the cancer treatments that the FDA has approved in the last 2 years, I believe that number is 54, that for all kinds of cancers, not blood cancers. 46 of those were funded by LLS and by what we're doing here. So this isn't just the raise the awareness of cancer type thing, it's that, but it's so much more, because we're providing the services that patients need and the research that is saving lives and changing lives. So with that, Steve, my hero, thank you very much for taking the time to come out here. Thank you all for paying attention. If you're looking for your own honored hero, this guy's one of my honored heroes. I can't think of anyone better to follow.
I second that.
Thank you, sir.
Yeah, absolutely. It's inspiration watching Steve in Tahoe last year after all he's been through. So